Good afternoon and welcome to the Health and Overview and Scrutiny panel. I'm Councillor Mark Jeffrey and I'm the chair of the panel. So to start off with, we've got some housekeeping and safety information. If the continuous fire alarm sounds, please evacuate the room and public gallery by the stairwells. Do not attempt to use the lifts. Please assemble in the turning circle at the end of King Henry Street past the University's Park building. In order to comply with the Guildhall Trust's fire marshal regulations, anyone who signed in at the Guildhall reception desk should sign out when leaving the building at the end of today's meeting, not if there's a fire alarm. Just get out for that. So today we're live streaming. May I draw everyone's attention to the fact that this meeting will be live streamed. Everyone speaking via microphone will be on camera. Members of the press and public are also permitted to record the meeting on the understanding that it neither disrupts the meeting nor records those stating explicitly that they do not wish to be recorded. Please can everyone use the microphones and remember to switch them off when they are finished. So if we do introductions around the table, so starting from my left.
Councillor Lee Tyndall from Portsmouth Copner Ward.
Councillor Vivian Attrill from Winchester City Council.
Councillor Graham Heaney, Portsmouth City Council Labour Group.
Thank you. I'm a Portsmouth City Council as well, should have said properly. So members have read the reports, so presenters please just highlight any developments that have occurred since the publication. I've had apologies from Councillor Oliver, Councillor Harris, Councillor Raffaelli and Councillor Minion. So the next thing is to declarations of interest. So has anyone got any interest they need to declare? Okay. So we're going to go straight on to agenda item 3.
Can I ask a quick question? Yeah. We have on the agenda paper, it says at the bottom of the second column on membership, a vacancy. Who and where does the vacancy come from? I presume it's not a Portsmouth council, is that right?
That's right. It's Fareham Borough Council who have chosen not to appoint anyone onto the HOSP.
Oh, okay.
So it's just a vacancy.
Okay, so agenda item 3 is minutes of the previous meeting. So we'll go through the our page 3. If anyone's got anything that needs correcting, please indicate. Our page 4. Page 5. Page 6. 7. And 8. So could I have a proposer to accept those minutes and a seconder, please? Graham, you're proposing, and a seconder? Thank you. Councillor Tyndall, seconder. Thank you. Okay, so straight on to agenda item 4. So it's South Central Ambulance Service.
Sorry, Chair. Just on last minutes, have we had the data from the, I can't remember the gentleman's name, about the practices and about the distribution? They said that they were going to bring it. I can't remember which point it was. It was GPs and then the dental practices as well, he mentioned. No.
Okay. So actually, that's reminded me, when I went through, how do we know that how do we know that the actions actually happen? Is there a recorder? I don't mean like physically recording, but is there a spreadsheet that we...
There isn't a spreadsheet, but yeah, it's obviously I follow up all the actions after the meeting, but yeah, I could do sort of some kind of table if you want me to.
No, it's fine if they get followed up. That's fine. But
Yeah.
if you've got if you have a spreadsheet anyway,
Yeah.
that
Yeah.
would be useful probably to share with members, so we can just have a sort of follow through with things. Thank you. Any other things on the previous minutes? So we've accepted those. The councillor's just arriving, so we'll just pause for a second. Councillor Vernon Jackson. Okay. Do you have any? Do you have any declarations of interest? No. Okay. So we've just approved the previous meeting's minutes. And we're going to go on to agenda item 4, which was South Central Ambulance Service. Now, you had some news for us, didn't you?
Yes, I had an email from Jodie earlier this morning to say that unfortunately she had to give her apologies due to unforeseen operational demand. So I don't know whether she's offered to answer any questions members had on the report by email, or members could perhaps defer it to the January meeting. I'll leave it to you to decide.
Thank you. So, members, what would you prefer to do?
It's probably easier to defer, I would suggest.
Yeah, defer.
Agree to defer that item then until the next meeting? Thank you. Okay, so if it's okay, we'll go on to agenda item 5, which is Hampshire and Isle of Wight Healthcare NHS Foundation Trust. So we've got Eugene with us today. Would you be able to come forward and when you speak, use the button on the right? Could you give a brief summary of your report? We have read the report, and then members will ask you questions. Thank you.
Thank you. Eugene Jones, Chief Operating Officer at Hampshire and Isle of Wight Healthcare Trust. Thanks very much for inviting us today to provide this report. We're really excited about the announcement that we formed a new trust, which is Hampshire and Isle of Wight Healthcare, on the 1st of October, as the report identifies. That's been the culmination of over 2 years' work in terms of working with partners, the local authorities, yourselves, patients, carers and residents, to try and get that into the best shape possible. And we believe that we've achieved that. We're going to be working through now a period of transition to form the new trust. So in terms of our clinical operating model, as the report identifies, moving from what are 13 service lines and divisions, which are inherited from the previous organisations, into the new clinical operating model, which is 7 divisions across the whole of the trust. And we're just about to enact that now. We've made appointments into those roles. Again, really excited around that leadership. We've got some great leaders in place, some really effective people and some great ambitions that we wish to achieve. Within the report, there's some examples of some, again, some contemporary work. So the single point of access that's literally just kicked off recently within Portsmouth, yielding fantastic results around the stopping, prevention of conveyance of people in ambulances when unnecessary. So 120 ambulance conveyances aborted as a result of that, and alternative routes to support those individuals, mainly in their own home or through primary care or indeed self-care, rather than those journeys in the ambulance. And that provides opportunity for the ambulance crews to then focus on those people who do need that access and do need that support. So again, really early days, but showing great signs of improvement. We've got, again, primary care services in Cosham, which are coming on stream with a new building in the new year, January 2025. And within Jubilee House, the MSK physiotherapy services that are, again, celebrating great work in terms of supporting people with musculoskeletal issues and great volumes within the service. So that's probably the sort of canter through the main headlines. Happy to take any questions.
Thank you very much. Over to members with questions. So I've got Councillor Vernon Jackson.
I'm terribly sorry, I haven't picked up. Who were you before you were created? What would I know you as?
Yes. So the new trust has been formed from 4 different component parts. So Hampshire CAMS, that was previously provided within the Sussex Partnership, was one component. We also then had the Isle of Wight services, which were combined with the acute trust on the island, disaggregated in May of this year. And then we had the Solent and Southern services, which came together formally in October. So they were the changes. So sort of four changes sequentially over a period of time, which the final one being the Solent and Southern merger together, which was on the 1st of October.
So the Solent and Southern provision is the bit that we will probably recognise here.
You would do, yes. Yeah.
Thank you. Any other questions from members? Councillor Heaney?
I mean, obviously, creating a new organisation is quite a challenge. You know, a lot of staff change and so on. How are you managing the integration of staff, and are you looking to make changes to services as you do this, or are you looking to change and improve services later on? Is the general approach I'm sort of looking for?
I think it's fair to say that over the past 2 years, the two main providers, Southern Health and Solent, have been working in partnership in that period of time. So as we got closer to the 1st of October, but before then, the services were working very much in a joint way, especially within this patch within Portsmouth, with Hampshire residents and Portsmouth City Council residents, and how we can maximise the use of the totality of the resource, how we can make sure that we have coherence in terms of how we provide those services. So we've done an awful lot of the groundwork already in terms of the service model, what we see as effective and great practice, and developing that sort of vision, if you like, with the new divisions. We are investing heavily in organisational and personal development of our teams to make sure that they can give of their best, that the structures allow them to do that, and also within the places across the 7 divisions, they have got autonomy to provide what the local population need, and have that support from the wider trust. So very much an opportunity to recast how we do things in the future, but certainly building upon all the great things that we've already got in place.
Councillor, do you have a follow-up? Yeah.
Just to say, I mean, I'm obviously aware that there was some partnership working going on, but I mean, I think the thing is, in terms of improving services, I mean, is that something that you think will evolve over time? There's going to be more opportunities to change and improve services as you go forward, rather than making big changes now as you start?
So we have a significant programme of quality improvement, and it's linked to something that we've called communities of practice, where we have, across the 7 divisions, we'll have specialist, knowledgeable clinicians, leaders and professionals that will be helping us to ensure that what we provide is consistent and of the very best standard across the whole of the organisation. So they're going to be a resource that will pull in and support the divisions to create consistency, to drive out unwarranted variation, and to provide the very best evidence-based practice. What we will be doing is, obviously over a period of time, we will be looking to improve that offer as we go forward. We need to consolidate, but we're also really keen that we get those quick wins, and we believe there are some, around sharing best practice across the new organisation.
Thank you. So I've got Councillor Vernon Jackson next.
So you can just, I'm sorry, just picking things up. So you will be, effectively, you're a provider who doesn't do the acute services. Is that right?
Yes, so we're providing all of the health-based community mental health and some aspects of primary care within the Hampshire and Isle of Wight footprint. The acute hospitals continue to provide that emergency and urgent care within their footprints.
Okay. And so we've been forced into an ICB which appears to be failing as we thought it would, and providing worse outcomes for Portsmouth residents than the previous system. What's it like working with them from your point of view?
I mean, the climate's difficult, isn't it? I mean, we're up against it in terms of the demand and the capacity, and I think what we're trying to do is make sure that we use the resource that we have to best effect. There is waste in the system. There is still opportunity to be more efficient with the resources that we have. And we have, for example, with the consolidation of 13 units of delivery into 7, that consolidates and focuses our leadership capacity. It makes sure that we've got greater organisational grip and oversight, if you like, in terms of the provision, to drive out waste, to drive out unwarranted variation. And our colleagues in the ICB are with us on that journey. We are working in partnership. It is a difficult climate that we're in, but I do feel that we have got leverage with the new organisation. It's an £800 million organisation. It's a big endeavour, and an opportunity to, in terms of the national reports around Darcy and the thrust and movement from out of hospital care and more effective community-based care, because the acute hospitals just can't function in the way that they have been over years. There's a real opportunity to lay our claim, if you like, around community support and enabling residents to be supported and looked after in their own homes, as more than we can at the moment. And I think that's where we're going. With the ICB, we're on that journey together.
Can I ask, do you do the palliative care team, community palliative care teams?
Yes.
I have to say that their performance with us was exceptional. I just wish we'd known about them beforehand. Nobody in the hospital, nobody in the community ever mentioned they existed.
Again, there's a really big programme around end-of-life care and what we can provide in the community. And it's not just about hospices, it's about enabling people to live out their last days in comfort in the surroundings that they find with their family, and all of those sort of familiar aspects. So and we've got specialists in the trust that are expert in doing that and providing that that philosophy, if you like, across the whole of the whole of Hampshire. Thank you. I'll feed that back.
So they're absolutely wonderful.
Okay, I've got Councillor Ashwell next.
Thank you, Chair. So now you've had this merger, how are you going to know it's actually worked? What's the milestones you're going to see?
So we've created a number of, in the support of the new organisation, we've created a number of patient benefit sort of measures, if you like. So I've talked about unwarranted variation, and that can be a bit of a sort of buzzword. Appreciate that, sort of management speak almost, but it does mean that we have got different pathways to treat people with the same conditions and the same presentations. Some are more effective than others. And so, what you want to be doing is providing that the gold standard, the best and most effective care all of the time and consistently for everyone. So part of our sort of our measures will be around some of the things that we're mandated to kind of to kind of cover in terms of the standards and the delivery, and obviously we're held to account by the ICB. We'll also be looking at patient-related outcomes, so the impacts from service users, the people who use our services and their carers. What do they want? We recognise at the moment that the way that we monitor our effectiveness is actually quite transactional, and it's based on sort of hard measures, sometimes around outputs rather than outcomes. And what we want to get into is a greater dialogue with people that use the services, to understand from them, in the way that the councillor just suggested, in terms of palliative care, what was your experience? Did we provide you what you needed and what you wanted in a timely way? That's a measure that we are going to be cultivating over time. For me, it's the most important one.
I had a question from a councillor that can't be here, who's on a hosp. So this is it's not a question, it's a point, but you might be able to address it. But I appreciate you might not be able to as well. So apparently there was an article in the Telegraph a few days ago that identified 12 NHS trusts which are in NHS special measures, and what concerns the council is that 5 of the 12 are in Hampshire. 4 of them central to the care of our residents. So one of one of the 5 is mentioned is Hampshire and Isle of Wight Healthcare NHS Foundation Trust. I don't know if you've seen that article or know about it, and just wondered whether, if you do know about it, what's the view of the trusts in relation to perhaps that article. So I appreciate you might not know.
I'm aware of the article, yes. It reflects the system and the providers within the system. So the ICB, the NHS Hampshire, as well as the provider trusts within it, which includes Hampshire and Isle of Wight Healthcare. It is something that this system, and going back to the climate, it is struggling with in terms of the resources that are available and managing those effectively whilst trying to respond to the demand that is ever growing and with a dwindling resource. And so I think this is essentially based upon the ability to manage the NHS finances in an effective way, and we are working with others again to try and manage that to better effect throughout the organisation. Again, going back to efficiency, how can we use those resources to maximise their potential? How can we use our staff to best effect new ways of working? For example, there's a heavy reliance at the moment around locum doctors or agency doctors. We're looking at ways to overcome that through either positive recruitment of doctors or new ways of working where we can allow other professionals to step up into the space that was traditionally a medical role. You can see that in primary care already with physiotherapists, with pharmacists, and with others that are taking on some of that role. That's an opportunity for us too, to make sure that we provide the quality, but also that we can provide some of the aspects around meeting the demand with a workforce that's really tricky. I mean, medical staff are few in number, and the pipeline is sort of 10 years away in terms of receiving those new graduates coming through.
Thank you. So this is a follow-up for me from your response, I guess. So what does the special measures practically do? Do you get extra assistance at all from centrally, or is it a detrimental intervention?
It's a combination really of those two. So additional oversight and monitoring with support from the regional and national team to draw down upon best practice. There are specialist sort of financial experts that can be drawn down again to look at where there might be greater opportunity to use resource more effectively. And we're working very much as part of one of the providers within the system as a whole to deliver the financial imperative that's been placed upon us. It's a difficult climate to achieve. I don't think there's any getting away from that. But we are, within Hampshire Healthcare, doing our bit to support that, and we are working with others as part of the system response to achieve that financial balance as much as we can.
Does anyone have any follow-up questions? No. So that was from Councillor Raffaella, I should have said. It wasn't from me originally. The other 4 in Hampshire are the Hampshire and Isle of Wight ICB, University Hospital Southampton NHS Foundation Trust, Portsmouth Hospitals University NHS Trust, and Hampshire Hospitals Foundation Trust. Councillor Van Jackson.
Because the ICB is failing, does that mean that all the others within the area are deemed to be in special measures as well? Or is there an individual judgment taken on a view of each organisation?
So my understanding is that when these conditions were imposed, they were based upon a system aggregate rather than a provider individual response. So it's the ICB and the providers within it that sort of triggered the response, which is why all of those are mentioned in the article.
All right, thank you.
Any other follow-up questions, members? Any other questions? No. Okay, so thank you very much. So we'll note that report. You're welcome to stay, but we understand you might not be able to. Thank you. Okay, so next agenda item is 6, adult social care update. So I've got down here Andy Biddle and Debbie Young. If you can come forward and just, for those that don't know, just if you could just tell us your job role, please.
Thank you, Chair. I'm Andy Biddle. I'm the Director of Adult Social Care for Portsmouth City Council. My apologies, Debbie isn't here with me. She is still in the office over the way working, but she had some stuff that she needed to do. So I will claim full credit for what she would have said. So the report in front of you is the 6 monthly update that's requested by the panel relating to adult social care. As discussed at previous panels, the report connects the work in adult social care to, as far as we can, to outcomes for the residents of Portsmouth, and this was a discussion that we had a little while ago. I'm grateful to my colleagues in adult social care for the significant work reflected in the report, and to Debbie Young, and also to Katie Downer, who worked to draft the report and get it ready. So I'll just highlight a couple of bits out of each of the sections and then take some questions if that's okay. Section 4 relates to national policy and legislation. Of note that the Care Quality Commission have been progressing their programme of inspection of Care Act duties and are now engaged with around a third of local authorities with adult social services responsibilities. The total number is about 153 of those authorities in the country. They've published 12 reports. The other point to draw out from that section is that the Mental Health Bill, which we assume will create a new Mental Health Act, has also now been introduced in the House of Commons for debate, and this was significantly delayed. I think we may have talked about this a couple of reports ago. It then disappeared off the agenda in the wash-up prior to the general election, but it's now been reintroduced. So we'd anticipate a new Mental Health Act probably within 6 to 8 months, I suspect, but when that will be implemented, I'm not wholly sure. Sections 5 and 6 update on the adult social care strategy, which is published on the PCC website, and associated strategy documents that have been recently published. These sections also cover developments in commissioning and performance management in adult social care, including discussing key indicators. For section 7, this details our key relationships in the city. Eugene touched on that earlier in terms of our relationship with the Health Trust, Community Health Trust. And we've included an update there on the newly created Hampshire and Isle of Wight Healthcare Trust. And the expectation that the ICB will be setting out its integrated community stroke service model during 2024, because that was an item that the panel was particularly interested in over the past 12 months or so. Section 8 covers the announcements in the autumn budget related to social care and the way that that adult social care in Portsmouth is planning to use the Accelerated Reform Fund grant. We've now had the second tranche of that fund confirmed to us by government, where at the time of writing the report they'd withheld that second tranche, but that's now been confirmed, so we will aim to implement those things that we've talked about around shared lives, carer breaks, those kind of things. Section 9 outlines the work with Portsmouth residents referred into the service in the last 6 months, including some feedback from our residents and information around how we manage waiting lists for assessment. And that section also sets out some of the work promoting independence and wellbeing, supporting our informal carers in Portsmouth, and how our occupational therapists engage with residents to develop services in their service. Sections 10 and 11 set out the intermediate care and reablement service and the shared lives service, and as referred to earlier in the Accelerated Reform Grant, the shared lives service we're looking to expand and develop in Portsmouth. And we've got some feedback in that section as well from some of our residents who access those services. Section 12 shows some of the achievements and planned work of the Integrated Learning Disability Service and the Portsmouth Mental Health Hub. It's worth noting that the Integrated Learning Disability Service was provided through Solent NHS Community Trust, and as Eugene referred to earlier, is now provided through the new trust. There's been no change in those arrangements in Portsmouth, but that's the gives an indication of some of the services, if you like, that the Trust provides and helps us provide. And that section also details the work for our residents who lack decision-making capacity in some areas and may be subject to a deprivation of liberty safeguards order, and also those in need of support when their mental health deteriorates and those in need of safeguarding support. Section 13 sets out the significant work in the area of quality and performance, from preparing for our inspection, we don't know currently when that will be, to managing our care record systems, contracting for services which our residents access to support them with daily living. And that section also sets out some statistics around the numbers of our residents who are in receipt of care home and domiciliary care, and some information about social care providers in Portsmouth under the market section. The work of social care providers in Portsmouth, it's worth noting, is also currently part of the Housing and Adult Social Care Scrutiny Inquiry during this municipal year. So the HASC panel have asked to meet with domiciliary care providers and providers of care home care within Portsmouth to understand better some of the challenges, successes, and how they might be able to help with their scrutiny. Finally, the report highlights developments in strength-based practice, learning and practice development and complaints, and we've put more detailed information referring to our Community Connector service, data around accessing our diverse communities, resident feedback, care provider work and complaints received by adult social care within the appendices at the end of the report. Hopefully that's a reasonable summary, but of course happy to take questions.
Thank you. I've got a question actually on it's your item 7, so it's on page 3 of your report, page 27 of the overall report. So it's to do with the stroke recovery support. So it's I think I'm a bit confused on the second bullet point. So it says that the work is already underway and will be completed in quarters 2 to 3 of the 24-25 financial year. But does that mean that the ICB won't be taking on the responsibility or the funding from the first day of the financial year, or have I just misunderstood that?
I'm afraid I can't confirm that, Chair. That is a decision for my ICB colleagues. I have had some correspondence in the last couple of days preparatory to coming to this panel, and we're expecting a letter from ICB colleagues detailing the pathway and how, from when it will come into effect. So I'd hope that once we've received that letter, I can share that with you as Chair of the panel and with the rest of the panel.
Thank you. In terms of sort of the countdown to the beginning of the financial year, how close are we to sort of a problem with that then? Or would that be covered in what you said you'd send through?
I hope that will be covered because we, if you recall, there was an agreement that it was agreed, I think it may even have been in full council actually in Portsmouth, for some temporary funding to be allocated to the Stroke Association, and that funding expires on the 31st of March next year.
Devon Jackson, follow up.
So, Andy, it's very good to see you, as always. So, my understanding is that in Hampshire, that in Portsmouth we have something different in terms of stroke stuff than anywhere else, and the ICB is made an undertaking to take this on and to work to produce the stroke pathway, etc. And with that undertaking, I think, was made in February of this year. We're still waiting on them to let us know what that is, and we're now in end of November. Okay, that's unimpressive even for them.
I think that's a comment rather than a question, is it?
No, it's a statement of the obvious.
Okay, Councillor Heaney.
Well, as someone who actually presented this issue at the budget meeting and did do quite a bit of work with the Stroke Association on this, I wanted to ask a question really about the process. I know Andy's not obviously from the ICB, but if he could pass the question on, maybe that would be the thing to do. What I'm interested in is whether the proposed model, because, sorry, let's take a step back. When the decision was made to put extra funding in. The ICB was in the process of looking at a range of policies, and one of the things they have to deal with is there is a national framework, I suppose you could say, for stroke recovery services, which they had not got around to looking at properly or implementing. So they are under national sort of pressure, if you like, to follow the national guidelines on stroke recovery service. Hence, they have now started to do the work on it, which is why they're looking at the services across the whole of Hampshire. So obviously, it would be good if they could then pick up the responsibility for funding that rather than the City Council, who has done it for quite a number of years. But we offered I suppose what we might call, say, an enhanced service to what was available in the rest of Hampshire at the time. And the Stroke Association was willing to continue that, but the funding issue wasn't going to be dealt with by the ICB at that stage, and so the City Council agreed to provide another year's funding to see through the proposal of developing a service. To get to my question, which is, I suppose the question now comes, is when the ICB come forward with their proposal, will this amount to a change in service, I suppose, and therefore potentially open for us to scrutinise, to ask questions about the change in service?
I can certainly pass that on. I think, so to be accurate, my colleagues in the ICB have been working on this. They've been working on the pathway as per the national framework, national guidance. I think they're intending to set that out, so that will probably take the form, I would imagine, of a range of services, a range of support that's available for people that have experienced a stroke. Whether that includes the Stroke Association, I don't know. I think if you as a panel wanted to ask for a copy of that letter to come to you to be able to scrutinise, I think that's within your orbit to do so, would be my view.
I mean, I was thinking we do have a meeting scheduled for the 23rd of January, which would be an appropriate time, I think, to have that and hopefully have a clear view from them, and then to come and answer questions that we may have about that. I mean, I'm conscious that you, Andy, the point you raised, that the issue is not about whether the Stroke Association has the service, it's what the service is that is key. It may be provided by somebody else, you know, at some future date. I think they always recognise that as well. I think the question is the quality and the nature of the service we're concerned about rather than the actual provider. So that's really quite useful. I suppose the thing is they will need to come forward, I think, to say how they're intending to fund it, and so we'd certainly like to know information about that. And I suppose we also want to know that they will be able to take that responsibility on from the beginning of the new financial year, 25-26, so we're clear about that. And what we would also want to see is, can we be ensured that there is going to be no break-in service as a result of any new proposal for our new framework, etc. Those are the sort of questions I would like to pose. And if they have those in advance, hopefully they'll come back with some good answers. So that's the sort of thing I was hoping to do.
I'm certainly more than happy to pass that on. As I say, I did have a discussion prior to coming here, and I don't think it's well. My interpretation is it's not anyone deliberately blocking, but I can certainly take those questions back and ask for presence here at the January panel to answer them.
Thank you. Are there any other questions, members?
I do have some questions on
Councillor
some
Heaney.
other aspects of the report, and they're not all the same, so I'm going to jump through, and I don't want to hog it, but if I was looking at page 15 of the report, page 30 on our papers, which talks about the mental health assessments, and there are a number of things there which I think are a cause for concern, I suppose. Delays in assessments, court service online system delaying access to warrants, delays in assessing private ambulances, etc., etc. I was at the Health and Wellbeing Board yesterday, and we had a report from the safeguarding officer about the safeguarding chair. Sorry, about about 3 cases which were referred to, and it seems to me that with all of these potential things here, there's a real issue of safeguarding potentially at risk with all these things. You know, if they all happen to click together and they all happen, then there's real problems. What are we able to do? Is anyone able to do anything to try and mitigate some of these and deal with them? I mean, no, we aren't responsible for some of these things, but you know, what can we do? What can be done, I should say, to try and mitigate some of these problems? Any suggestions?
Thank you. Yeah, so we have peaks and troughs. I think it's probably fair and accurate to say in terms of the number of people who are so unwell that they need an assessment under the Mental Health Act and potentially being detained in hospital for treatment, assessment and treatment. So at times we can manage demand and people get what we would regard as a timely service and a timely response, and at times we can't. So when we find that we're not managing that, we not only cooperate across boundaries with our colleagues in Southampton, Hampshire. So our approved mental health professionals will be having very regular discussions about where the priority is across the county. But we also work with our Integrated Care Board colleagues for their overview of what they're commissioning in terms of both secure transport and in terms of acute hospital beds, acute mental health hospital beds. Those beds tend to fall in Eugene's area now, in the community trusts area, so we have quite significant and regular communications there as well in sharing the pressures and trying to work out solutions. I think the court service is more difficult, I think, as an issue to work through. We do have communication, we have discussions with the court service, but we're not always able to effect change there. So it's a question of where's the greatest pressure, how we monitor that, how we work together to make the most use out of the resources that we have. So if I can give an example, at the beginning of this week, there was a forum held across Hampshire and the Isle of Wight, the geographical area, which was chaired by our ICB colleagues, which was assessing the risk that we've got across our whole patch. There were 4 or 5 people that were waiting for a Mental Health Act assessment. And you can't really you can't implement that assessment until you've got the ambulance and the place to place someone. And we were identifying a significant lack of places at that moment in time. And so the ICB was then using their commissioning ability to talk to our Community Health Trust colleagues and to try and leverage some more capacity so that we could help people get in those beds. So it's a question of trying to make the most with what we've got, I think it's fair to say. Much of the time we're able to cope, but there are particular areas of pressure, and what we try to do then is work with all partners involved to try and resolve those and get the best result for the resident.
Did you have a follow-up on this issue?
Just to follow up on the issue, I'm assuming that the online system of data and court service is not a local issue, it's a national system, and therefore it's not a local problem as such. It's something that will be affecting lots of different areas. Ministry of Justice, yeah, we need to get our MPs having a bit of a go at the Ministry of Justice to get them to do something about it, maybe. So that's my idea. Yeah, thank you for that. That's helpful.
Yeah, thank you. Are there any other questions on this issue? If not, we'll go straight on to your next one, please.
Next one, page 25 or page 49. Trouble is, page 49 has www.portsmouth.gov.uk, so it's quite difficult to work out. So I go on the one I can actually read, which is 25. The bottom of that page, the paragraph talks about the CQC, and we know the CQC have been criticised for some of their inspection work, and they now, as it says, they're adopting a risk-based approach. And it says, due to this approach, services are inspected as a high proportion of services subject to enforcement action. So presumably that is just because they only act when there is something brought to their attention that they need to. So it's more than likely that an inspection will result in some sort of action rather than the general inspections when it's like the standard ones. So that's not something we should be too worried about.
Yes, I mean, you're absolutely right in your analysis as we understand it. I think we're still concerned about it because we are seeing services that haven't been inspected for some little time, and whilst there's contracting safeguards from local authorities, because we buy a lot of the places in these services and so we have an overview of them from a contracts perspective, that won't be as thorough a look at how these services are managing as an inspection will be. So you're absolutely right in your analysis. We're going to see far more services because they're doing risk-based intelligence-led inspections. But we've still got an issue with, and this was identified, it was the DASH report was the report into CQC that was published recently. And it was identified that we need to have more regular inspections of providers. I mean, in some cases, we've got ratings that go back to 2019. So it's very difficult for people when they're looking to understand if they want to place someone or buy a service personally as to whether that rating is still reflective of the service that's provided. So there is a broader issue, but you're absolutely right. We're likely to see far more enforcement action.
Are there any more follow-ups on this question? No. Oh yeah.
Only in the sense
Sorry,
on the next page it talks about the number of care homes, the number of care provision, home care and domestic care that are rated as good or outstanding, and it's been reduced. And it seems to explain it in relation to care provision and extra care. And I'm sort of asking, well, what does that mean? Is that something that is sort of accidental, or should we be concerned? I mean, I'm sort of take the view that any reduction is a matter of concern. So how do we explain that reduction?
So particularly around extra care, we've been working with two of our buildings in Portsmouth, but it's the same provider, for round about a 12-month period now. What we were finding was that we needed to support them with learning and development, in particular for their staff, ensuring that people were getting the right level of care. In extra care developments, you may find people that have come into extra care that don't actually have care needs, but they want to be within that environment, so they might have purchased their own property within an extra care environment. And it's trying to make sure that the service that is being contracted for is focused on the right residents. And so we've been working with the provider for some little time to ensure that that gets right. They get that right, excuse me. We've also been working with the provider around their management oversight of the care, ensuring there's the right level of governance, that, for example, if someone is in need of their care needs escalating and getting in extra support from them, then that happens. That people are getting one-to-one supervisions, care workers are getting supervision. It's a very skilled role. We want to ensure they're getting the care and support that they need as staff in those environments, as well as our residents that live there. So it is of a concern when we see a reduction, but that's about right. Given the size of those schemes, that's probably accounts for that reduction.
Any other questions on this issue, members? No. Any more questions? No. Councillor Tyndall.
Sorry, just going back to that issue, and it's on the same page, the 27, about the budget and the increased national insurance contributions. Have those the care settings, and maybe the general question of our external providers, how are they going to react to that? Are they planning to cut their services, and how will that affect the services that we provide as a council?
It's difficult to know without having got there. So each year, and it's the right time of year for it, when we're preparing, supporting the council to set its budget, which, as you know, gets voted on in February. We're also looking at the care market and understanding what the cost pressures have been or will be into the next financial year. Certainly the national insurance contribution changes, both the, I think it was about 1.2% or thereabouts increase in rate, and the decrease, the reduction in the threshold down to 5,000, will affect social care providers. Many of them are small providers, especially in Portsmouth. So there will be pressure there. Service reduction is a little more complicated because they'll provide what the council pay for. So we, within our budget setting process, we have to balance the money available we've got for an inflationary uplift, how we spread that, where the greatest need is, without seeing any reduction in service, because we have statutory obligations to purchase or provide a service to people. So the market will struggle with the national insurance contribution stuff, changes. It's also probably worth noting that the monies that were announced in the budget for local government, so it was about a 1.3 billion in total across the country, and around 600 million of that was dedicated for social care. A lot of that money is likely to be taken up by the need to increase the fees paid to care providers. The adult social care market, around about 95–96% of it is provided through the independent sector, both in terms of care homes and in terms of domiciliary care. So where there may be a level of protection from the consequences of national insurance contribution rises for public bodies, local authorities, the NHS, there currently isn't that same level of protection for private providers. So whilst it's great to be getting more money in the budget, and we haven't seen how that money's presented yet, we'll find that out in the local government finance settlement in probably the second or third week of December. We're sort of anticipating a lot of that's already spent. So difficulties, we'll aim for no reduction in service. We'll try and price any uplift to take account of those difficulties in the sector.
Thanks. Did you have any follow-up on these?
Yeah, just one more. So based on that then, so and sort of links in with the inspection, how are we going to assure as a council that the provider contractually what we paid for is delivering that and not behind closed doors is cutting corners effectively?
So we know quite a lot about our providers in terms of the size of their business. We also use models for uplifts that price in minimum wage and that sort of thing. We also have feedback. We carry out reviews. We carry out a review on an annual basis of anyone that receives care and support in Portsmouth that we fund. We also have contractual reviews with providers. So whilst we were talking earlier about the CQC reviews, because we hold a contract with these providers, we also review their business and what they're doing. And ultimately, we also have families and individuals themselves. My experience is a lot of people will be telling us straight away if they think they're not receiving the care and support that they need and that's been agreed that they will receive. So we've got various mechanisms both through ourselves and also through those people receiving care and support and their families to understand the quality of what they receive.
Are there any more questions on this issue? Any more questions on the report? Okay. Well, note the report. Thank you for coming this evening. You're welcome to stay, but obviously we understand if you aren't able to stay. So thank you. Okay, so the next agenda item is item 7, which is Local Women's Health Hubs Development Programme. So if the people could come forward for this and introduce yourselves and say your job titles. We've read the report, so if you could just give a brief summary and then we will ask questions. Thank you.
Firstly, thank you for having us here. My name's Hannah Byrne. I'm one of the public health principals working within the Portsmouth City Council, but I've been working closely with the NHS and other partners for many years.
Hi, yeah, I'm Fran White. I'm the Associate Director of Policy Innovation and Partnerships at NHS Hampshire and Isle of Wight.
And I'm Helen Atkinson, Director of Public Health for Portsmouth.
Can I ask, is NHS Hampshire and Isle of Wight the ICB? Thank you.
And as we go through the paper, if we do mention the new provider trust, we'll call it formerly known as Solent to make it easier. Solent NHS Trust.
So we've read the report, but did you want to give any brief summary before we ask questions?
Thank you. First of all, just to be clear, throughout the paper, although we'll be referring to women's health, we are talking about the health of women, girls and other people that are affected by some of the issues that we talked through the paper. We've been really grateful for the England's first women's health strategy because it has been used to springboard the work that we've been doing for many years around some of the issues that are captured within the women's health strategy nationally. However, we identify that the National Women's Health Strategy is quite clinical, and actually we take quite a holistic approach to women's health in Portsmouth and with our partners, and therefore we continue to do that, and we continue to advocate for that holistic approach across regionally and nationally, which has been great. We've also really pleased that because we've already had that great foundation, that we've got quite a very good relationship. So when we are going to other meetings, we do recognise across the country, we do recognise the struggles that other areas are having, that they are actually at the very starting point of building those relationships and some of that group work. Since the paper, there's been extra work that's gone on, including some of you might have seen the strategy proposal for the strategy for women violence against women and girls, which we've been part of, and we really are keen to support that pillar relating to prevention and early interventions. We're excited to work on that. We've got some great updates about some of the research. We look forward to, in the new year, looking at the findings from the research from national surveys and local surveys. So again, that we can continue to use the voice of our women and girls to inform the work we're doing. Optimising on campaigns. Strengthening the work we're doing for our LGBTQ residents. And what's also really good is that because we have got this great relationship, we are able to continue to work in partnership to challenge what we're doing to tackle inequalities within intervention programmes for people with long-term conditions, including diabetes and HIV treatment and care. We're happy to take questions.
Great, thank you. So members, are there any questions? It's really comprehensive report. Councillor Van Jackson.
Top 3 things that should happen and who should be doing them?
Okay, top 3 things.
Reduce it from 37 to 3.
Continue to... Okay, so I'm going to take a layered approach because I like to think about it in tiers. So I think that we should be normalising healthy conversations around the effect of menstrual disorders. I think it's really great. There's been some really great developments with us being able to talk more about the impact on menopause, but we need to acknowledge that periods and the impact on menstrual disorders is having an effect on our children and our people, our working population, our carers, and it is having an impact on all layers of the system. So, yeah, first of all, normalise those conversations and tackling stigma. I'll probably then talk about the continuous quality improvement we're doing with general practice, including optimising on our pharmacy provision as well to be able to free up some work within general practice. And within that is about building on those networks within general practice. We're really, really lucky. We've got some really keen, engaged staff across general practice, nurses, doctors, and we're great that we've got that dialogue between us. And then lastly, over to you, Fran.
So my 3 were very similar. One was around taboo, the other was around supporting our clinicians to feel confident to have those conversations, as you said. And I think there is some work to do on pathways. I think a lot of, certainly in the national policy, a lot of the pathways listed are pathways that are probably not at the forefront of clinical strategies in the past. So actually by giving a bit of a focus to the pathway around long-acting reversible contraception, we can really make a difference through just putting some focus onto those pathways. Endometriosis is another one.
And so that building pathways is about continuously to build those relationships through the different partners, because we acknowledge some of the biggest issues for women are that, well, like every human, we're very complex and we very rarely come with just one issue. So actually managing multiple conditions that might be physical, emotional, mental, plus our living conditions isn't easy. And we acknowledge, and this came through the work that we've done for our women who experience substance misuse, they've got lots of issues, and especially if they're mothers or carers, that's a lot of appointments to deal with, and especially in a world where there's a lot of reliability on digital. Not too much.
The other half of my question was who should be doing it?
Every single person. Sorry. Okay, so who should be doing it? I think we need to absolutely optimise on those champions across the systems. And we've got some events planned for next year so that we can bring people together. We've got our NHS Futures platform, Community of Practice platform, where we're continuing to build those relationships. So I think through continuous strong leadership, continuously bringing the different partners together, and continuously taking that conversation out.
And I think what you're saying, could I just add that ultimately, or you would often see this as an NHS only area of clinical support. I think what you see in Portsmouth and the relationship and the working between Fran, who is the NHS Hampshire and Isle of Wight lead, and as you know, Hannah is our Portsmouth lead, is that they work very much together because there is a role for local government. And this paper coming today came off the back of, I think, a full council motion around inequity for women. And ultimately, the outcome of not getting the clinical support right, as Fran talks about pathways, is an impact on education, an impact on the economy, that is often not highlighted. So I think the fact that we've come together shows the true integration of working and understanding that we need to work on women's issues across the whole of the public sector. And I think in the slides that you see the financial impact of not doing so. And obviously school absenteeism is a big key priority for our education team in the council. So it's all connected, as are, I think you've just said it, human lives are all connected. And I'm particularly proud of the work that Hannah and Katie because Fran, everything you do is fantastic as well, but and I know you've heard about this work, in the Project W, which will be launched in December. I'm afraid only women can attend that launch, but that was on the back of working with women, as Hannah said, who are substance misusers, getting support, often in abusive relationships with domestic violence, where they were having to go into the same facilities and services as the perpetrator. So, you know, this is an example of when you actually ask women what their needs are and look at the opportunities, and that is again across NHS, across SSJ and across the council in putting that service together. So it's about looking for those, and I've always advocated for the integration work we do. It's about looking at the opportunities we have. So I just want to advocate that these two professionals are a good example of that, wanting to make a difference by doing it together differently.
Thank you. I've got Councillor Heaney next.
Thanks very much. I mean, I think you're doing really good work and excellent work. I suppose my question relates to section 3.3, which it talks about the National Women's Health Hub specification being applied, because we aren't effectively going to get a health hub in every city and every community. That's not going to happen in a sense. So I suppose the report says local work in Portsmouth aspires to provide equitable access to provision summarised in the Women's Health Hub specification. And you go on to say in the last sentence, it's recognised delivery listed with the provision can contribute to providing more equitable person-centred care, which is one of the areas where local efforts are being made related to women's health programme work. So I suppose the question is this really happening? Is there still problems in some areas where this is not being provided, and how do we tackle that if it is?
And so what we are also advocating for is women's health issues to be captured in more data sets. So, for example, actually getting data around from clinical systems or even education systems about where people are having time off work for reproductive health issues, or going into to their GP for things like menopausal symptoms. They're very challenging. So we are continuing to advocate to have that data in the systems to be able to better monitor improvements. That's one element.
And I think, so the services listed in the Women's Health Hub, and thinking about the national ask, it didn't feel right for Hampshire and Isle of Wight to have one Women's Health Hub in Hampshire and Isle of Wight. That doesn't serve me as a woman of Hampshire and Isle of Wight, and I don't think it would serve any of them. But actually the services listed are all services that are provided generally within primary care. And actually I think in Portsmouth all of them are provided in primary care. but it's about quality improvement. So are those pathways easy to access? Do women know that they can access them? Lots can be accessed through pharmacy in Portsmouth. Do they know that they can do that? So a lot of it is around how do we improve those services rather than set up something new, which we may not be able to sustain.
I think that's a really good point, Fran, because I have to say, and I've worked at DHSC, there's always an over tendency in the national guidance to create or talk about creating hubs. Immediately people think that's a new building. That's not what this is about. This is about ensuring that all of the services are of good quality and are provided where they're already provided and are known to be provided. Women do know that they can go to the pharmacy for their contraception, morning after pill. Women do know that they can go to primary care, but actually I think what we're also looking at is that opportunity, and I know we've just talked about Project W, for those targeted, more vulnerable women and girls who might not access those services because they're not comfortable. We've got migrant health, for instance, as another area. It's about ensuring that there are those services available where they are, because it's not just the City of Sanctuary you're working with as well, isn't it? And also the obviously Project W. So it's about looking at opportunities where people are.
And then and as well as that is the opportunity to find out, keep hearing the voices of the women and girls about their experience within general practice. So we're going to be, there was a national survey, there was the regional, local survey across Hampshire Isle of Wight, which Portsmouth have had quite good uptake of through our channels of communication. And then on the back of that, we're going to be coming together at a P3 board, which is about Portsmouth provider partnership, to then use those findings to say, and what else do we need to ask about our residents in Portsmouth? Exactly that, and that specific question about, and what practice are you with? And building on that, because we do want to get that equitable position. And then the other bit is around, because that's a lot of those, looking at then the data around cervical screening coverage, long-acting reversible contraception coverage. But going back to that, unfortunately, so it is that. I guess it's a holistic approach to try to keep asking up to find out, are our residents getting the equitable access that they deserve?
Councillor Hinney, have you got follow-up?
Yeah, the point about knowing that you can go to different places and how you know that is really important. I mean, the other thing that sort of struck me was that, and it's not necessarily related just to this, but I know of one practice where your ability to use e-consult is restricted. You effectively can't use e-consult in the evenings. And to be honest, I thought that was completely bonkers. You know, the thing says contact us at 8 o'clock in the morning. Well, if you're going to work up at 7 o'clock, how can you consult? You can use it. And I'm thinking, why are you setting a system which people would use to find out about whether they've got a problem or need to do something, and you're stopping them accessing it? You know, this is the sort of thing that really frustrates me. That we try to do that, but there are these silly blocks that come up, and you know, can we do something about that in some way?
I was going to say, and I really do hope that through our work that we're trying to do around asking people their experiences about accessing healthcare for these issues, we can try to share some of the good practice around, for example, how are people. We know that residents are invited to cervical screening through a national invitation process, but actually how are the practices making that easier to take up appointments rather than having to wait for 40 minutes on the call? Actually, do some of our practices have here is an easy way that you can access your cervical screen. We know you've just got a letter. Others are doing, you've spoken to someone about, so we really would like to do that. And I appreciate it's much bigger than just those issues that affect women.
Councillor Ashwell.
Thanks for your report. I can see you're doing some great work. Can you just explain a bit more about how you're reaching out to those people who maybe don't have English as their first language?
Yeah, this is definitely a multi-pronged approach, and we're really grateful for the partners that we've got across the city. to be able to continue to link in with that relationship, because we acknowledge it's not just about language, but it's also about trust and being culturally competent about some of these things. So we're really lucky that our Hampshire colleagues have just done a big bit of research in Havant area, isn't it, just down the road, which we are pleased that brought to the ICB Women's Health Hub Board. So again, that was one benefit of being able to share some of these community insights. So we're looking forward to using that and engaging with our colleagues across Portsmouth who are already within those different communities with where English isn't their first language. We've also got a GP practice who's just starting to do some of the, going to be doing the training around group consultations, and they're going to be a pilot. It's just been agreed that there'll be a pilot site to do some group consultation with some of our Bangladeshi community as well, because they've already got these links in. And another great piece of work that we're really excited and pleased to be part of is for our around maternity. So there's a big piece of work around equality for maternity. We've got an equality steering group for Hampshire, Portsmouth, Southampton, Isle of Wight, and it's an ongoing piece of work to claim those insights and those channels so that we can keep going out. But it's definitely, in public health, we always talk about proportionate universalism, and we recognise that for some of our communities, we need to do that little bit. We need to do a bit more to make sure that they get that we can tackle these inequalities.
Yeah, and just to add on to that, so we've recently run a survey that Hannah's referred to across Hampshire and Isle of Wight. We've had a really, really good response. We've had over 1,000 responses to that survey. It was aimed at people who have experience with menstrual health or the menopause, so it's aimed at mostly women, but other people as well. And what we're looking at is who we haven't captured within that 1,000 and what populations do we need to target. And we'll then be running focus groups across Hampshire and Isle of Wight with different communities where we know we're not hearing their voice.
Something that's come quite strong is, but like with Cross and it's put in the paper, is the life course approach as well. And we've, again, linking with our colleagues across Hampshire, Isle of Wight, even from that school age, actually, a girl who might have menstrual disorders, one of the first things that they might be offered is the contraceptive pill, which wouldn't be culturally, although it is to manage that clinical condition within that culture, that for some of our cultures, it wouldn't be acceptable and could bring negative consequences. So we absolutely, as one example, through to menopause, where in some languages there isn't a word for it, and if they're first or second generation move to England, there might not be anyone that's been able to tell them about it. So it really is, again, that holistic approach rather than just a clinical approach, and it's definitely a long-term program of work.
My employer, which is Portsmouth Water, has it's in training, but it's sort of compulsory, but menopause awareness sessions, and I just wondered whether so we all participate. I just wondered whether the Portsmouth City Council either do that or would look at doing that.
Yes, we do actually have training in place. It's not, you don't have to do it, but it is already in place and part of the offer. We also have, because I chair and facilitate it, a menopause group. It is women only, but we have up to sometimes 70 members of staff. We've recently done a wellbeing afternoon in the council. But I think the important bit there is also that men have that training as well. And it's really, I know you mentioned, there's been such a lot of stigma around menopause for so long. It's really only recently it's been opened up and discussed more, but that work is, so there is training in place, and we're also looking at the possibility, because there's new national guidance around training for managers, perhaps where, particularly, not to pick on, but where male managers have been perhaps a little bit less understanding of what some of the women in their teams are going through.
Yeah, that's partly why I was asking, because this was compulsory for everyone, which I thought was really good. But obviously, I guess particularly in terms of managers within the council, obviously there's a cost implication, but to me it would seem a good thing to do. So there's another local organisation that does do that. So if I pass that information on, you can use that to try and persuade people perhaps to do it at the council and your other organisations. So, Councillor Tyndall.
Yeah, just a question with regards to linking. I know you've got in there about linking with education and the PSHE system. Just interested about what you've done with regards to local sports clubs and linking with them and Sport England nationally and tagging into their data set and then the GPs with the social prescribing into sport.
That's a really good point. We're actually within the Portsmouth Physical Activity Alliance, we're proposing to take something to there, especially in relation, including for pelvic health, because we recognise actually incontinence can have an impact on people's confidence to be able to do exercise. Definitely a life course approach. There was something recently came out about encouraging women to swim as well, acknowledging some of the challenges that they go through. And we've recently put, it's called Pads on a Roll, which is free period products within one of the sports venues. And I think it might be in the report. So there's so many great pieces of work, but that's definitely an area of interest. So luckily within the public health team, we've got a physical activity lead. But I definitely think it's definitely important across the life course to encourage people keep them into sports, and bring them back to sports as well. So thank you. We'll take that away as an action to look into actually the opportunities in the next quarter.
Yeah, so I was on a conference last week, and Sport England were there, and their big drive is everything to do with linking in with public health. They've got, so they say, don't quote me if I'm wrong, they've got a huge amount of data driven, and certainly with regards to the women in sport and girls in sport, and they've just finished their Girls Can campaign and things like that, and they've got a lot of data with regards to participation and things like that, so it saves you collecting it. And I know it's done regionally, so Portsmouth is just about to be announced that we're going to be an area of special importance, as in they've identified us that we need to do more sport-wise, so that might be something to back on or jump onto.
That's wonderful, thank you. And there's so many aspects that we acknowledge that affect women and girls that can have an impact on sport. So it'd be really good if we could then come to the Physical Activity Alliance and take that holistic approach using the data from Sport England. Yeah,
just sort of linking in the pathways, just basically using it as an advertising through there. So, thank you.
Members, are there any more questions? So, thank you very much for your report, it's noted, and thanks for coming. We're now at the end of the meeting, so thank you, members. That is all on the agenda today. The next meeting is on Thursday, the 23rd of January.
Chair?
Councillor Van Jackson.
I am new to your committee, august as it is, but there are things I quite like, things I think would be interesting to look at. How do we input those into this process?
So that was a question that I asked before the meeting, and I was about to say that I think that there isn't a mechanism at the moment to do that. So I think that as members we should email each other, but through me perhaps, so that we can see if there are things that we want to put on the agenda.
Okay, can I give you my full now? So
you can do, yeah.
So it'd be interesting to look at suicide prevention, because it is a devastating thing for families. Breastfeeding, I understand, is hugely important for kids building up immune systems, immunity and things like that. And yet in Portsmouth we are low in terms of numbers of women who breastfeed, and that would be interesting. At our last meeting we had a report about access to GPs, and I have to say that the graph they showed there, about how quickly people could see their GP was unbelievable to me. It said that 50% of people saw their GP that day or the next day, and I'm sorry, my experience of trying to get a GP's appointment in this city does not ring true with that. And then the last bit, I just thought it'd be quite interesting to know from the hospital what the new A&E is going to be like and what effect it's going to have on, because at the moment it is awful, having spent far too long in there on many different occasions. But it'd be interesting to see what they think the new facility will be like, and how it will help move things along.
I had something actually that actually Graham you touched on about e-consults. So I have similar experience, but what that you know you're in effect they don't want you to ring quite often, which I can understand. But then you go to the website, you go to the e-consult, and it's not available at certain times. It seems absolutely bonkers to me. So I had about customer experience. Who looks at the customer experiences at GP surgeries? You know, I'm sure we've all got individual, which we can't do, individual sort of stories. But actually, my experience is that it's quite hard as a customer to navigate, shall we say. But yeah, so if there are any issues, if you email through, or either all of us or through me and Lisa, we can look at putting stuff onto the agenda. Yeah. Okay.
Well, I've tried to gather information from a conversation I've had about the rollout of COVID vaccine and some of the issues around supply related to the way the NHS system works.
Found an NHS system that works.
No, related to the way one of the NHS systems works. So it was quite interesting to hear the Inspector and I were talking about what was going on in relation to COVID vaccines. I mean, I am still gathering information, so I'm not in a position, but I think probably I'll let you know next week or two when I have the relevant information. But I'd ask for somebody to put something in writing so that I can actually, not because I want to expose my sources, but be able to fully understand the complexity of what's actually going on. Because it is a complicated story, but I have been picking that up. And because it affects local provision, I think it's something that we should probably consider, and I'll actually be in touch with you about it when I'll get clearer.
The other thing that I was going to ask, since we're being sort of, is about, so there was a council motion, I think 2 councils ago, about I'm going to get this wrong because I can never say this right, ADHD medicine, and the lack of it when it's prescribed. And my experience is that there's other medication that, so I have to take Creon, which is to do with pancreatic issues, and you get prescribed for the rest of your life, 6 months at a time, but you have to keep going back every month because they don't have it in stock. And it just seems incredibly, and I totally get that there are supply chain issues, but actually it happens now all the time. But that must be incredibly inefficient for the for the pharmacies, as well as not being great for customers. So I think that's something that I'd quite like, but I don't know who would be able to sort of look at that, whether it's the ICB.
We do have what we call pod teams that are out there to cover podiatrists, ophthalmologists, dentists, and community pharmacy. It's not podiatrists, it's pharmacy. Yeah, so we could ask, obviously, having on right NHS, and it's Simon, you know Simon very well, John.
Thank you.
So that,
yeah.
So one of the other the pharmacy bit is really interesting. It's I think the second largest number of closures on the high street over the last few years have been pharmacies of all, because the pharmacy contract is so bad that 75% of them are losing money. And why would you open a shop to lose money? But more and more is expected of them, and yet they're shutting left, right, and centre. And it'd be interesting to talk to people in the pharmacy organisation about how things are in the city and wider area, and what we could do to make things work a little bit better.
Some time ago we had the round table
Yeah.
So we can't do any other business and I know I've been participating in this as well, but we're not allowed to. So thank you, members. That's all on the agenda today. The next meeting's Thursday, the 23rd of January, and I officially close the meeting and ask Lisa to stop the live stream.